3rd of December 2011. I was coming from Port Harcourt. I went to Warri to go and visit my patient, and I said I should come to Lagos to come and attend experience, and I had a different experience. I came down at Anthony bus stop to take a bus to CMS, and I was standing at the bus stop with other people. Suddenly someone came to my back, dragging my bag, and I said, "What?" And the next thing I had was a gunshot to my neck. And at that point, I knew the anatomy of the neck. I knew I may die. But I said, if I could get to the hospital, I may be saved. So I started asking for help. Everybody ran away. So when I saw that nobody came to my rescue, I sat down, started praying to God. I said, "God, forgive me my sins." Started asking for mercy. And suddenly, somebody from the crowd, unknown to me, they were looking at me from afar. Maybe I was going to die. Somebody said, "I know him. He was my classmate." And when they came around, I started pleading, "Please take me to hospital." And the man said, he's going somewhere, can't take me. And I said, "You that I know, you not leave me here." I started pleading. And a driver who was just coming from work said, "I will take you." He had just 1,000 with him. He stopped a cab and they took me to hospital. And at that point, I brought up my insurance card. And at that point, I said, "Call this number." So he called the number. And when he called the number, they said, "We're taking me to Lode." They called immediately and they gave them an authorization to go ahead and treat me. By the time I got there, doctors were waiting for me. Funny enough, I had a group of orthopedic cardiothoracic surgeons who was headed by Dr. Femi Thomas, the President Executive Director of NHIS. So finally, I want to encourage every Nigerian, if you do not have health insurance, if you are not registered with a health insurance policy with the NHIS or other bodies, please buy it. 15,000 with NHIS or any amount can buy you a health care. As a doctor, I have access to health, so I may say I do not need it. But at the time, I had an accident when I never suspected I will, and the health insurance that I had came to my rescue. If I did not have health insurance, I may be a dead man today. So you may be a market woman, you may be an Okada rider, you may be a professional, you may be a lawyer, a doctor, you may be anybody. You need access to care. As a doctor, you need another doctor to treat you. As a lawyer, you need access to care. As a market woman, you must have a health insurance in place. And it is high time that the National Health Bill be passed that makes it compulsory that every Nigerian should have access to health insurance.
The most constant thing in life, they say, is change. Most resistant thing in life, again, is change. You sound flowery and gloating. Are you saying you have not encountered those who are resisting change?
Well, thank you very much. I agree with you in total that change is very difficult to manage. When you are managing change, even in an organization, you need what the Yorubas will call babang bejo. Because by the time you start managing change, you will step on toes. And then you need one babang bejo somewhere who can support you when necessary.
Who is your babang bejo?
My babang bejo is the President of the Federal Republic of Nigeria, who had graciously given me the opportunity to influence my profession, to influence the health of Nigerians at all levels, at this very important stage of our development. That is my babang bejo, number one. And I've told you about my minister, I've told you about my governing council. You can see how I'm sitting comfortably. Having sorted that out, then change in society. There is problem of perception. People say they are just collecting our money. You see labor saying, all the while government has been paying, we haven't seen anything. We're introducing another carrot to them now. We say, pay your own contribution and we'll cover you in retirement. Because we all know that one day, we'll have to sign off in the office and join that vulnerable group in retirement, whether we like it or not. This is what we all even desire. we pray that we live long. When you live long, there are issues that go with age. You get that. That is when all the diseases of this world will start knocking at your door. And whether you like it or not, somebody must pay for this. So we are saying, while you are still active and mobile, pay your own contribution and we'll cover you in retirement.
I'll be introducing to you all the grand comedian of the Federal Republic, Gbenga Adeyinka the third.
The first, my brother. The first. All right, good people, are you still here with me? This is the time when we collect the access from him and we take the access into our hands. Mr. ESA, you swear to tell the truth, the whole truth, and nothing but the truth. So help you God. Okay, good people, this is your opportunity to ask him questions. You are closest to me, so let me allow you fire.
My name is Shola Ogundipe. I'm health editor of Vanguard newspapers. Yes, persuasion and coercion. There is an act that is going to make health insurance compulsory. And there is a school of thought that says people respond better when they are persuaded. Now, this idea of coercing people to buy into health insurance, what are the guarantees that it is going to provide the expected results?
The issue of coercion, compulsion, I think we really need to understand the context. It's not about somebody putting a cane behind you and say, you must contribute. What we are saying is that there must be health insurance for everybody, whether you can afford it or not. That's the element of compulsion that we are talking about. That is, for those that are working, they will make some contribution. For those that are not working, the people who are working and government must provide for them. That's the element of compulsion that we are talking about. Because whether we like it or not, health is a must for everybody. We must be healthy for us to do our day-to-day activities. So it's not about coercion. It's about making health insurance compulsory. That we get to a level where those who can afford it will pay for it. Those who cannot afford it, somebody will pay for them.
Don't forget, it's www.nhis.gov.ng. We know the website.
Yes. There's another thing you haven't done. info@nhis.gov.ng. Your messages get to me on daily basis. So if there's any complaint about any of our programs or services, just use info@nhis.gov.ng any day.